So pelvic floor dysfunction is basically when the muscles of the pelvic floor, which are many, and they're composed of something that we call the levator ani complex, don't work correctly. And oftentimes they work against other organs in our body, like the bowel, the bladder, or our reproductive organs, like the uterus. It's funny because a lot of people think of pelvic floor dysfunction as incontinence, and it can only occur in older women. But interestingly, pelvic floor dysfunction can occur in any age group, and it can also occur in men. I always explain pelvic floor dysfunction like this. Think of your bicep, okay? So a lot of people think of their bicep and they think about having really strong muscles, right? And they say, oh, okay, so like if you have a bicep and it's overly contracted, are you gonna be able to lift a lot if it's overly contracted? No. So even though it's a tightened muscle, it's a weak muscle, and that is pelvic floor dysfunction. For example, something like the bladder is contracting, the pelvic floor is not relaxing around the bladder so that you can empty. The bladder is contracting, the pelvic floor is tightened, you don't completely empty, you leave a little bit of urine in your bladder, that causes urinary frequency. You gotta go, causes a symptom of persistent urgency. Oof, I always feel like I have to go to the bathroom. And then sometimes it can cause leakage because your bladder contracts, your pelvic floor spasms, and you empty.